Mr. Omar Bukili. He's the incident commander for the city's COVID-19 incident command system. Omar?
Thank you, Mayor. Happy to be here tonight.
Also joining us is Doug Kress. He's the Director of Health and Human Services for the City of Somerville. Doug?
Thank you.
You want to say hello, Doug?
Good evening, everyone. Can you hear me?
Well, you can wave. Coming a little choppy. We see you when you see that smile. Also, I would like to introduce Mr. Rich Raish. Rich is the Director of Infrastructure and Asset Management, also a Somerville resident with children in the Somerville schools. Rich?
Hello, happy to report out on everything we've been doing.
And now from the Somerville Public Schools, the Chief of Staff, Somerville Public Schools, Mr. Jeff Curley.
Good evening. Thank you, Mayor. Glad to be here.
And the School Committee Chair for the Somerville School Committee, the Somerville Public Schools, Ms. Carrie Norman.
Hello, welcome to the first full week of school. And on behalf of the school committee, I really want to thank all of our staff, our city staff who have been working incredibly hard, and our community partners, how to bring our kids back and our staff back safely to schools.
Thanks, Carrie. I would like to introduce the Assistant Superintendent for Curriculum, Instruction, and Assessment for the public schools, Chad Mazza. Mr. Mazza.
Good evening, everybody. Thank you for joining us.
Thanks, Chad. And now let me introduce the Director for Equity and Excellence for the Somerville Public Schools, Ms. Jessica Boston Davis. Jessica.
Hi, good evening, everyone.
And the Director of English Language Learner Programs and Family and Community Outreach for the public schools, Ms. Sarah Davila.
Good evening, everybody. I'm happy to be here.
Thanks, Sarah. The Student Services Director for the Somerville Public Schools, Ms. Liz Doncaster.
Good evening, everybody. Happy to be here.
And the Chief Communications and Development Officer for the public schools, Ms. Susanna Hernandez Morgan. Susanna.
Good evening, everyone. Thank you for joining us. I'm happy to be here.
The Director for Early Education for the public schools, Ms. Lisa Q.
Glad to be here. Good evening.
And for all you high school parents, he needs no introduction, the Principal of Somerville High School, Mr. Sebastian Lagambina. Mr. Lagambina.
Good evening, everyone.
And finally, but not last, the Director of Special Education, Ms. Christine Trevisoni.
Thank you so much for having me. It's a pleasure to be here.
I also want to take a moment. I just want to say they're listening in and participating from the Somerville School Committee, Mr. Andre Green from Ward 4, Ms. Alana Krepchin from Ward 2, Ms. Laura Petone from Ward 5, Dr. Sarah Phillips from Ward 3. And as we are made aware of others participating, we will recognize them. I want to thank them and other members of the school committee and the Somerville City Council for their collaboration and support and participation and everything we're doing to respond to COVID and to prepare for school opening. So as we move forward, and as we've been responding to COVID, and as we've been addressing the issue of reactivating parts of our lives, our economy, and taking on the issue of reopening schools, at the center of our compass is maintaining a focus on health and safety. We have always said, we're guided by two stars as we thought about reopening parts of our economy and community during the first few phases. One, to make sure that we do, whatever we do, ensures the health and safety and well-being of everyone in our community. In this case, we want to make sure we continue to ensure the health and safety and well-being of our teachers, staff, students, their families, and our communities. And to make sure that any reopening of any parts of our lives, in this case, the schools, is durable, is sustainable. And that's really important. We've been planning for a safe and sustainable reopening of our schools now for months. We've kept health and safety at the center of our focus throughout this pandemic. We are continuing to analyze and monitor the evolving landscape of COVID-19, not just in Somerville, but across the region, the country, and around the world. We've been diligent, deliberate, methodical, and cautious as we move forward. We've kept equity at the center and trying to understand that this is try to really understand the complexity of this virus. As you can well imagine, and if you don't, let me make it clear, we had no pandemic response plan here in the city of Somerville, like every other community in this country. And while the national government has failed miserably to respond to COVID-19, and Massachusetts has been trying to keep up, Somerville has acted with its values in mind and that of our community, their health and well-being. So we're going to continue to work diligently, deliberately, well-informed, being guided by the experts in health and epidemiology that are at our disposal and by the data. But we also want to make you aware that we are acutely aware of the challenge this is for families. I in particular am aware, as having 2 sons still in the Somerville Public Schools. I want nothing more than for my high school senior and my 7th grader to be back in school today. And we understand and very much aware the impacts it has on families, especially working families, to have to deal with issues of supervising, have your children at home, and also the impact on kids and their learning development, their developmental needs, and so forth. So while we have that in mind, we want to make sure, while we're aware of that, we want to keep in mind that we cannot go backwards in terms of our response to COVID, and we cannot risk people becoming ill, more people. COVID continues to be with us in Somerville and Massachusetts and the country, around the world. People continue to become sick and they continue to die. We now have 42 deaths in Somerville, and there were about 9,000 in the Commonwealth, and now 200,000 in this nation. And as we move forward in dealing with COVID, we need to find out and understand better how to operate in what we continue to refer to as the new normal. But we need to do so with the best tools at our disposal and making sure that we do not participate in the transmission of the virus from one person to another, but continue to interrupt it. So this time, I'm going to hold up any further comments and refer to the superintendent of schools to talk about what we have done, what the schools are doing, and welcoming families back at this point. Madam Superintendent.
Thank you, Mr. Mayor. So first, I want to say welcome back to everyone. It really has been a wonderful 2 days. As a long lead up to this, we spent most of the summer as well as the 12 days of training that the Department of Ed allowed us to be able to really focus on our curriculum development, our work on our schedule, to have it reflect a lot of the comments that we collected in surveys and focus groups, our materials and resource distribution, really making sure that every family and student is situated as best they can be to begin the remote phase of our hybrid phase in. And it really has been wonderful. The energy has been tremendous. I think for students to be able to be connected with their educators, see their teachers, meet their teachers and staff and principals, and for the educators to see the children has just been very life-giving and exciting. So thank you to everyone for their hard work with this. Particularly to the families for also helping to situate the students in the best way that they can, making sure the connections happen. I know there's a lot of hard work that's going on back in the homes, and to our staff that's really just worked tirelessly to get us to this point. We're looking forward, and had the commitment to you to make the remote portion of this the best that we possibly could. And I think we're off to a great start. A big shout out to Somerville High School and the orientation that the mayor referred to earlier. Really was tremendous. We had about 400 or 500 people that attended it at different points. And it was quite a feat to pull off, but they did a great job. So just a reminder on a few things for folks to remember coming into the remote portion of the school year. The day very much, we developed it to feel like the school day. Students have their schedules. There's a combination of live instruction as well as their asynchronous or independent work. The school hours are the time of the school, and the school year in terms of the calendar is the 170-day year. We've assigned cohort assignments. Again, this is for in lieu of the hybrid when we begin it in person. So students have been assigned an A or a B cohort to bring half of the students in the class back on 2 days and then the other half back on the other 2 days. Technology and access, we've been doing everything relative to Chromebook distribution, hotspots, Comcast, really trying to work. And if at any point there's somebody out there that currently is still having trouble, we're again encouraging you to get to your school principal, let them know what you need. There's going to be some additional multilingual sessions that are going to happen Wednesday to Saturday of this week from 8 to 12 in the morning. Lots of resources and materials going out. We've structured kits to go home with students for supplies so that they have what they need in addition to what's back into the schools. The breakfast and the lunch continues to be a hot item. We've structured 11:30 to 2 for distribution. We're also looking right now at some morning hours to make it easier for families that may want to pick up on their way in. And then enrichment programming today was actually our first day for recreation and community schools. And I checked in with both programs. It sounds like everything went really well. Students were very excited to see their peers And so we're looking forward to that being a big complement to our remote program. Just a reminder in terms of the model that we have a phased in hybrid. We did have a small group of parents request a completely independent system, which we're calling the learning management system. We've been clear this is really only for asynchronous work with some limited tutoring support. It's for families that may have developed relatives that are with students or tutors that are with students that are able to actually support them academically independently. But other than that, we really want everybody to be involved and enrolled in our regular hybrid program. I think there's 13 families or so that are involved in the LMS. Everybody else is starting remote in the hybrid, and that will hold true until conditions for safe return are met, which is what we'll discuss tonight. At the point when in-person return is possible, we have committed to make sure that every family will have a choice to remain remote if that's what they want to do, or at that point to be able to come in person for the 2 days that the hybrid offers. And then just to give a sense, as we talked about the phases for the hybrid, we've been clear from the start thinking about particular special needs, high needs populations for special education, our English language learner newcomers, levels 1 and 2, understanding for that population that they will struggle the most with the remote to get all of their services and skills that they need. We want to prioritize them for phase, the first phase for 2A and B. This is to give you a sense of the number of students and teaching staff and support staff that would be involved in returning in the hybrid in person. We then in phase 3 start with the youngest students, the pre-K to K, recognizing they too really could benefit upfront from the in-person learning. And then again, staggering grade levels, 1 and 2, 3 and 4, 5, 6 and 7, 8 together, allowing just a short duration in between to be able to have the ability to refine any kind of model or systems that need to be adjusted. This gets us all the way back up in terms of full population, again, half on any given day. So this just gives you a sense of when we talk about the phases, which populations we're referring to, and this has stayed pretty consistent. And so, we look forward to talking tonight and hearing about the point of time at which we can start to be able to look to welcome our students back in the hybrid in person. I'm going to hand it back to the mayor, but I would like to just say thank you very much to the mayor and to the city staff. They've worked aligned and close with us from the beginning of this, keeping at the center safety and health for our students, for our families, and for our staff. And we appreciate that in their partnership.
Thank you, Madam Superintendent. Before I move any further, just a comment as people are starting to generate questions. Here's how you can, if you have questions of mine, you want to get them in, and as you're thinking of them, you can, if you're on the Zoom link that was publicized, you can please use the Q&A function. Some people are already doing that. If you're watching from YouTube Live, welcome from there. Use the comment section there. We will monitor and review that and gather questions from there. And if English is not your first language, you can just populate either the comment section on YouTube Live or the Q&A section here in your native language, and we'll have the interpreters interpret the question. And I'll get back to Q&A more as we get towards the end, but if you have a thought and you want to put it down, you can start doing that now. And thank you. So thank you, Madam Superintendent. We mentioned we are focused in planning for a safe and sustainable reopening. And what's that mean? Again, we want to ensure that whatever he does, make sure that whatever he does ensures and not puts in jeopardy the health and safety and well-being of our school population, teachers, staff, our students, their families, our community, and that all our efforts are sustainable in doing so. Soon you'll be hearing from speakers from the city who've already introduced themselves, Jeff Curley, Doug Kress, and Rich Raish. But the main idea we want to stress here, I want to stress here, is that Somerville, the city, the public schools is putting in the front work, which will and has taken longer for students to return, with the hope that really the reopening, when it does occur, would be more impervious to the unknown, the unforeseen shocks that will require the schools to open it, to close again. I want to remind everyone that it's not a question of if, but when the resurgence or part 2 of the next wave of the pandemic hits us, we've all done, and you deserve a lot of thanks. And thank you for what you've done to help the city's response to COVID and doing our part to flatten out the curve and maintaining the stability of our healthcare system. That saved lives. We need to make sure that the resurgence, part 2, isn't as bad or even worse than the first phase. That could be catastrophic to our lives, our community, and result in long-term closures of not just our economy, but our schools as well. And so that's why we talk about being sustainable in our efforts. There are many factors we continue to analyze, monitor, measure, and understand when thinking about the opening of schools. And the school opening is really an integrated plan that involves internal and external factors. Factors within the Somerville's control include, building ventilation assessments and improvements, routine COVID-19 testing and contact tracing protocols being operational, and in-person social distancing protocols set to create a safe work environment for the staff and for the students. When all these align, the public schools can begin moving to a phased reopening of the school. But I want to emphasize and make clear there are still external factors beyond the public schools and the city's control that directly and will directly impact the ability to progress through phased reopening. And those include community transmission rates, positive percentage in school, evolving science and research, and the availability of material and human resources. So, and now I want to move forward and let's start to explore some of these external factors. First, let me make clear, the earliest date to Somerville Public Schools, based on what we've analyzed and understood thus far, the earliest date that can begin to move into a phased implementation of a hybrid in-person instruction for prioritized student populations that the superintendent has outlined, really as December 1, as buildings become available. We're going to go into that in a minute. To understand, though, the public schools' projected timeline, let's first focus with the external factors that are really influencing the decision of when to move to later phase in-person instruction. A safe reopening depends on really what we refer to a constellation of related factors and data, or many variables. So, first, anyone who claims that there is one magic number or threshold point is really not informed in putting convenience over safety. A particular % positivity rate has different implications if it's trending up or down, or if we do or don't have sufficient testing and contact tracing. That said, there are some specific indicators that we do, and I'd like to look more closely at in the next slide. So of this constellation of indicators and factors, 3 key indicators of the status of the virus include: 1, the positive case rate, the percentage of positives among all testing that is being carried out, and how quickly testing results are being turned around. This is important. Here you can see in this slide the levels of these indicators generally accepted to indicate high risk, moderate risk, or lower risk. Now, what I want to emphasize is that lower risk still encompasses some level of risk. The rate of cases per 100,000 persons parallels the governor's reopening map levels. The percentage of positive cases among those tested has emerged as really a global standard for assessing the extent of the virus in a particular area. The test turnaround time matters because, let's face it, without a quick turnaround, contact tracing becomes ineffective and spread cannot be really effectively reduced. Again, these are just some, but not all, of the indicators guiding our decision making. There was one caveat, when we speak to the rate per 100,000, it has to be informed by percentage of positives when community testing is really robust. So for example, a positive rate of 8 in a community of 80,000, like a city like Somerville, may not reflect the percentage of positives under 1%. Rate is a good indicator if testing is not robust. Now, when we think about internal factors, there are many factors we look at. First, I'm going to transition to Jeff Curley, the Chief of Staff of the Somerville Public Schools. talk about in-person social distancing and some of the operational variables that will be implemented, analyzed and measured as we think about going back to school. But let's begin to take a look at the internal factors that we can control. Again, that starts with social distancing and other safety measures such as hygiene and safety protocols that we have put into place. So now I'll turn it over to Jeff. Jeff?
Thank you, Mr. Mayor. So echoing you and the superintendent, our top priority here is obviously the safety and well-being of our students, our staff, and our families. Just want to take a few minutes to highlight some of the safety and health protections that we have put in place over the summer. And obviously we'll go into some of the building improvements and other work that remains this fall. All of this work has been guided by local and regional science and medical advisors who have helped us develop this layered approach to health and safety that you see here. And we've been working, we the district have been working closely with our partners, the Department of Public Works, Health and Human Services, our school nurses, the mayor's office to prepare for the safe return of students and staff. So these are some of the measures that are in place. The check marks indicate the work that has been completed, and obviously we're going to go into detail on some of the other work, particularly around air quality and building ventilation. I also just want to highlight on the next slide that the district has, with the city, secured significant amount of personal protective equipment. So all of our schools are laid out to support 6 foot or more of physical separation between individuals. We're utilizing outdoor space. We have the medical and cloth grade masks that will be available for students and for staff. Our remote food sites will continue to hand out masks to the community. And we've done work reconfiguring our bus transportation. And as mentioned by the superintendent, while we have the weather with us, using as much of the outdoor space as possible. So today we had more than 500 kids across more than 10 sites in the city, utilizing community schools and recreation, parks and recreation programming. And that went quite well for a first day. So all of this is just to highlight that we've put together a significant layered approach here to keep our students, staff, and families safe as we look to return later in the fall. And now I'll turn it back over to the mayor and to Rich Race to talk a little bit more specifically about the building improvements.
Mayor, you're on mute.
I should have this down by now. So we're going to talk about internal factors which include building mitigation and ventilation. Scientists globally have come to a broad consensus that aerosol transmission via the air is perhaps the greatest risk factor, especially in poorly ventilated indoor spaces. At the end of this slide presentation, Dr. Scott Pino talked a little bit about aerosol transmission. This consensus began to emerge early in the pandemic, and the WHO, the World Health Organization, joined that consensus in July. And aerosols have been shown to travel more than 6 feet and to hang in the air. This is why, for example, face coverings matter. This is why addressing our ventilation systems matter. This is why our expert advisors, who just happen to be world-class scientists, who we are lucky to have in this area and at our disposal, have urged us to address air quality in the schools to keep our students, to keep our staff, and to keep our community safer. Let me be clear, and I speak for everyone on the panel and the school committee and city council and the superintendent. We will not roll the dice with our students, with our staff, with our teachers, and skip this step just because the state did not require us to address this significant factor. To date, the state still has no plan. We are working through a plan to get our air quality to meet safety standards. So with that, at this time, I'm going to pass this presentation on to our Director of Infrastructure and Asset Management, Rich Race. He's going to provide more detail on how we are aiming to ensure that every child, every teacher, every staff member or visitor in our schools is breathing safer air. Rich?
Thank you. So the City of Somerville and Somerville Public Schools started this effort a lot earlier than some of our neighbors did. And we've gone through a comprehensive assessment and have looked at both surface and aerosol transmission. Of the two at the moment, as the mayor said, the one that is more important in terms of COVID-19 prevention is aerosol transmission. And the one that needs more attention in terms of building systems is also the air handling. In terms of surface transmission, DPW can effectively clean on a regular basis to reduce that. The children can wash their hands to reduce it, but there's nothing other than masks and social distancing that can be done to reduce aerosol transmission. And even with that, there is a large importance in making sure that our building systems are reducing that transmission risk. Again, unfortunately, the federal government has not come forward with guidelines for how one controls that in buildings. So what we have had to do is turn to a professional association, the American Society of Heating, Refrigeration, and Air Conditioning Engineers, ASHRAE, who did early on issue guidelines for what they, as professional air handling engineers, got behind in terms of reducing aerosol transmission risks. So that is what we have adopted. And while some districts may have implemented measures that should reduce risk in an unquantifiable way, we're taking a very scientific way of looking at these buildings and these systems to make sure that the way that we handle air in these buildings reduces the risk factors. And there are three major ways that you need to think about reducing that risk in the air: is air change rates, what we call ventilation, how often we turn over the air in a space and vent it to the outside and bring in outside fresh air into a space. Air filtration, effectively removing the virus or the particulates or the aerosols on which they sit out of the air that is recycled. And then also humidity control. Virus transmission is more effective in humidity extremes, very low humidity, very high humidity. And if the humidity can be controlled, less important as the air ventilation and filtration, but it's still a factor. You can kind of think in New England why we have that flu season and the dry winters, which is something we want to avoid to make sure that we've got keep the humidity levels up to reduce transmission rates. Next slide. So we've been going through a methodical process, and you can kind of see our rationale here from left to right. Starting in June and into July, we identified all the risks that are in our existing buildings. We evaluated all the buildings and all the individual spaces in those buildings for COVID-19 potential. And then through August, our engineers looked at what we could do to those building systems and what things we could bring into those rooms to reduce that potential risk. And this was looking at all possible mitigation measures and the resulting transmission reduction. Based on that potential, we're able to assess our buildings and determine if some of our buildings can or cannot meet our thresholds for reopening. And we can go into that phase of this project in the next couple of slides. Next slide, please. So we brought in Fitzmyer Tochi. They are specialists in air handling. They work a lot in the hospital space. So they are experts in preventing viral transmission, which was a necessary skill set. We worked along with DPW and Somerville Public Schools to review all of those spaces and what those spaces are used for at both building level and room level. We assessed the risks and identified the potential improvements. Next slide, please. The two key questions that needed to be answered on this first phase, the primary audit, do any spaces currently meet our thresholds? And if not, can those spaces be brought up to our standard and meet those thresholds? So next slide. So that gives us a range of answers on those questions. And because we wanted to be methodical on all our spaces, and we have a lot of spaces to look at, we developed a numerical scoring system from 1 to 4. 1 being the lowest risk, 4 being the highest risk, which gives us basically 3 categories. If a room or a building receives a score in the ones, basically 1 to 1.9, that is a low risk area. In terms of aerosol transmission, that means that the air handling is consistent with those ASHRAE guidelines for aerosol spread transmission. For a score of 2 to 2.99, we're in a moderate risk. There is air handling in the space, but not to the levels of the ASHRAE recommendations to reduce aerosol spread. When you get into the 3s, 3 to the 4, we're into a high risk area with little to no air handling. And essentially, because there's no turnover or filtration of that air, that means that the aerosols can concentrate in that area over time. In terms of our own threshold, we've defined that low risk within the ASHRAE guidelines. So essentially, to open a building or a room, it needs a score of 1 to 1.99 for student use. Next slide. So again, that low risk, the scores in the ones. The initial building assessment, what we have in place, the schools scored from a 2.02 to a 3.4 with a median in the mid 2s. And assessing what can be done to those schools to improve the conditions, that would pull those scores down to a 1.2 to a 2.14 pi, with a median of 1.54. Next slide. So we'll now step through each one of the schools. So anyone on this Zoom can understand where their individual school falls out, and they are listed in alphabetical order, but by pure serendipity, the 2 bookends on the assessment happen to be on the first slide, the Argenziano and the Brown. The Argenziano is a relatively new building with good central air systems that can be upgraded. So right now today, on our overall risk assessment, that building gets a 2.09, which defines it at the lower end of the moderate risk. And those systems can be upgraded, both the centralized systems and in-room upgrades that would get that risk score all the way down to a 1.2. On the other end of the spectrum is the Brown School, obviously the oldest active school in the district, and it currently sits at a 3.67 because there's no centralized ventilation or HVAC systems. And the only ventilation is via the windows, and only in-space options could be mobilized. The best that those in-space technologies can get us is down to a risk score of 2.01. Next slide, please. The Capuano, also a newer school, lands in the moderate risk in East Somerville, currently at a 2.32, also moderate risk. Those are both fairly new buildings, or actually the East happens to be our newest building, but is highly efficient in terms of how it handles air. Both have centralized air systems, and so much like the Argenziano, in those areas, we can do things to the centralized air handling and put in room to bring both of those schools down to the low risk category. Next slide. The Healy and the Kennedy similarly have centralized systems because of particularly the size of the Kennedy and just the way the Healy is built. There are several different subsystems within those buildings, but there are centralized improvements that can be done to that, as well as the in-room improvements. So both of those schools can be brought from the moderate risk category into the low risk category. Slide, please. The West, again, a newer school in the Winter Hill, although it's sort of 70s, both have centralized systems that can be upgraded along with the in-room. So again, bringing them from the midpoint of the moderate risk down to the midpoint of the low risk for both of those buildings. And then on the next slide, the high school, because of course we've got the new high school under construction. The high school is spread around 3 buildings. The ASHRAE has the CTE programs and Next Wave Full Circle programs. Also an older building, very similar to the Brown, with no centralized system. So currently sits in the high risk score. Again, with the in-room units that could be mobilized there, could only be brought down to the moderate risk. So it's difficult to get to those areas to anything better than that. The existing high school, which has part of the building of the high school is the oldest building in the city, and the other wing is very near thereafter. Again, no centralized systems on that. Currently sits at high risk. And given the size of that building, there's really nothing that could be done in a meaningful way before the new high school opens. So we didn't even assess a potential score for that. The mods, the temporary classrooms that sort of sit in front of the high school and by City Hall, those are modular units. Each one of the rooms essentially has its own air handling. They're set to an efficient way of operating at the moment to reduce sort of utility costs. But as they currently sit, they're on the low end of moderate. Those units can very easily be switched over. The filters can be increased and the outdoor air exchange can be switched over very quickly to get that into a low risk. It is also worth mentioning, one of the reasons why we decided not to go any further with the old existing high school is that the new high school is coming online. Construction will be done on that for the majority of that school, with the exception of some specialty areas in the auditorium in December. So when that building comes online in December, again, those are all brand new systems, and we can operate that at a very low risk air handling. On the next slide. So in summary, no buildings currently achieve our thresholds. Occupancy of the old high school, the Brown School, and the ASHRAE are not feasible. But the combination of centralized and in-room solutions for all of the other spaces make all of those other buildings, including the new high school and the mods at the high school, all viable for play. So we have already extended the lease for those high school mods beyond what was needed for the high school construction. So that real estate is available to the district for the entirety of the school year. So although we have a few buildings that cannot safely open, we will be working with the district and with our contractors to make sure that those dislocated students have other buildings to move into, so that in-person learning can resume regardless of what building your children currently go to school. Next slide, please. Which brings us to what we're doing right now. The next step is the detailed evaluation. We've already answered the question, are the buildings okay as they are? No. Can some of our buildings be brought up to the level we want them? Yes. So now the next question is, how quickly can we mobilize contractors and equipment to get those buildings to our safe threshold? And how do we then best integrate our construction timeline with the phased reopening plan that Superintendent Skipper outlaid, that we're prioritizing certain student populations? So how to line those two things up. Next slide, please. So that's where we are right now, that strategy development, identify the buildings that can, or the spaces that can and cannot meet our our target of December 2020, or December 1st, so that we can start our phased reopening plan. Next slide, please. Now, what that detail looks like is that not all spaces require the same level of air handling. And this is true in the hospital spaces, in healthcare spaces, and we're drawing a direct analogy from that. Nurses' stations, for example, you have a presumed positive. By the time a kid gets there, is sent down to the nurse's station, the fear is that that kid may be positive. So therefore, nurses' stations have to have special air handling in them to make sure that the air in those spaces doesn't get commingled with the rest of the school. How you handle that air is special. Classrooms, those have the most number of people, the most number of students for the longest duration. So therefore, we've got a high demand on how we handle the air in those spaces. Then there are other lower use spaces that don't have as high a demand. So we can triage our construction to make sure that we are aligning those two things, and then define our construction schedule for each space, which is vastly different for each one of the buildings because they have different spaces or different systems and the different spaces. And then align those improvements to the phased occupancy and evaluate how prioritized school population can utilize available spaces quickly. Also do the three-dimensional chess on displaced students from the older buildings that can't be reopened, and sequence that with a phased opening plan. Next slide. So again, we've been at this since June. We've gone through sort of a methodical process. Right now, we're in an engineering heavy phase where we're doing the preliminary designs on all of those systems, figuring out the schedule and the cost estimates to get those things into place. We are moving very quickly from that into a procurement strategy so that we can get contractors, so we can order equipment and get contractors in the spaces and start the work in all of those areas, undertaking all those COVID-19 improvements in October and November to hit our December 1 phased opening of the buildings. And then that brings me to the last slide, where I will also point out that just because we're driving towards that doesn't mean we'll stop doing improvements. We will always be seeking to make these buildings better. And for example, one thing that we likely will not do in the first phase are things around touch. The plumbing operators, hands-free plumbing operators. These are things that are great ideas, but aren't necessarily thresholds to entry to these. So we'll continue doing routine upgrades to all the buildings, even after we've started the phase opening. But that's been our approach. Again, it's it's driven by the data on transmission, and we want to have a way that's demonstrable that we're meeting our thresholds, rather than simply saying we're buying some HEPA filters and that's a good enough solution. So thank you, and I'll turn it back over to the mayor.
Thanks, Rich. Thank you for that in-depth information and content. I know that'll generate a lot of questions, and well, it should. I'm going to transition to the Director of Health and Human Services, Doug Kress, to talk about the other internal factor and component that we can control, which is access to testing and effective contact tracing. I want to remind everyone and clarify that all these components and factors are integrated to work with one another. I also want to emphasize that even if we effectively executing, operationalize, and controlling all those internal factors, the external factors have a direct impact on our opening, or when we open and whether we're sustainably remained open. Doug is going to talk about the testing piece and contact tracing. Obviously, we want to test as much as possible. We were the first city in the Commonwealth to test residents who are asymptomatic. That information is critical to understand the status of the virus in that community, and also contact tracing, which gives us important information in real time on how the virus is evolving or changing in our community and where we can intervene strategically and understanding the source of any outbreak that is occurring. So at this time, I'm going to hand off to Doug Kress. Doug?
Thank you, Mayor. I appreciate the time to be here and welcome parents and staff. It's always great to talk with you. I think we all understand that research and experts continue to emphasize the importance of our seasonal flu vaccines. Each year, we lose thousands of people of all ages that are affected by the influenza, leading to a lot of hospitalizations and even deaths. This year, we have an added challenge of the COVID-19. So getting a flu vaccine is more important now more than ever. We know that flu symptoms are very similar to those of COVID-19, and preventing the flu is going to save lives, and it's going to preserve our already stretched healthcare resources. So we need to approach this as a community and as a public health effort. So with the support of the city, the Board of Health is actively working to issue an order going beyond that of the governor of the seasonal flu vaccine and COVID-19 protocols for all students and staff here in Somerville. To reduce some of the barriers around some of these issues, the city, along with the schools, are going to be hosting free seasonal flu vaccine clinics. I encourage you to keep an eye on it from your individual schools, because we will be going from different schools to be offering a variety of clinics. Of course, you can always contact your medical provider. I think that's always an important thing to do, because that way it's already tied to your medical records. Of course, there's always the option of going to your local pharmacy, whether that be a Target, CVS, or any of the others for your flu vaccine. All of these will, if you allow us, be added into the state's database and the system following all the flu vaccines. This allows us to keep a record of every vaccine that you've had so that we're able to track that, and you won't have to keep submitting it. However, if you do go into your own physician and you're not part of the tracking system, please submit your vaccine records to your school nurse so that we're able to track and ensure that you do have that flu vaccine. Additionally, we're going to be adopting a very robust COVID-19 testing. It's another indicator to move us forward. And that's why we want to make sure that we have the ability to have a routine COVID-19 testing protocol in place. For this, we've adopted a protocol that we'll be implementing as school buildings reopen. The protocol includes testing students, staff, and close contacts to provide a safe place to learn and work. Next slide. As buildings are reopening, we want to implement that robust testing protocol. I want to be clear about the benefits of routine testing in our schools. It gives us the ability to identify positive individuals who are symptomatic and asymptomatic. This will prevent additional spread of the virus. Preventing infected individuals from returning to a school too soon, especially those who are asymptomatic and don't feel they have the virus. They still may be infectious and can shed the virus. Finally, we want to provide us with a timely local data on our effectiveness of all of the efforts we have put forward. This will help us make future decisions as we move forward. Next slide. Mayor, would you like to introduce our wonderful partnership before I move forward, or would you like me to take care of that?
I'll kick it off, Doug. So the public understands, as I've stated publicly in the past, as part of developing our testing surveillance or surveillance testing plan, we are close to an agreement with a third party provider and also now the Broad Institute. We're excited. The Broad Institute right now, for some context, has agreements with 110 colleges, universities in the region doing their testing surveillance. We're excited to, as we are close to finalizing this, to be one of, I believe, 4 public school districts that will be working in partnership with the Broad and third-party provider to collect samples and do surveillance testing. This is going to be critical to our moving forward. So, Doug, I'll hand it back to you.
Great, thanks, Mayor. And it's great to have them on as one of our partners here in the city. We're extremely lucky, and thank you for your leadership on that. I think one of the things that we want to talk about for a full service testing, what does that include and what do we need to think about? So we want to make sure that testing is easy and professional and within our protocol for screening and will be administered within the buildings themselves. That will eliminate any of the barriers that we may have or our students and staff may have whenever we're talking about doing our protocols for testing. The tests are going to be administered by a trained and hired professional. I think that's an important thing to keep in mind as we look at this. For this, we will be including our sampling, and that's the collection of the collection using swabs. Currently, I want to keep everybody informed that new technologies are always evolving and coming around. Right now, we're using the swab because we want to do the best. We believe in the gold standards for all of us, which is a PCR testing. So doing the testing, we'll also be looking at how rapid those results come back to us. As you saw in one of our indicators earlier, we talk of less than 24 hours. We also want to ensure the data is secure, that the data is secure and seamless to and from the lab, and specimen reporting is accurate and on point. We also want to ensure that the testing supplies are available and not limited by the market that may be out in front of us. We may have heard different stories about that over the past couple of months when we were hearing there were shortage of tests or there weren't enough tests around. So we want to make sure that we have ample testing available to us. And then finally, we want to make sure that the delivery to the lab is secure. And part of our protocol is making sure that the third party is able to deliver those samples in an efficient way. Next slide. So a little bit more about our details of our testing. I talked already that we wanted to have make sure that this is going to be easy and is done in a professional way. So our protocol is with the screenings and the testing that they'll be administered at the school, as I said earlier. Additionally, we want to make sure that the tests are administered by professionals, whether those be EMTs, nursing assistants. And I want to remind us that this may change if new technologies become available as well. There are some for adults, as many people know, when we're using that anterior nasal swabbing, that some people are choosing to do it on their own. That's okay, as long as we continue to do it with an observed professional, or is observed by a professional itself. We also want to make sure that we're doing this in a timely way. So we are going to start with a baseline testing that'll occur within 24 hours before entering students are ready to open up or before we have the schools open and ready for students to enter. This will then be followed by routine COVID-19 testing, again, that will happen on site. If follow-up testing or testing of close contacts is required, testing will be done in coordination with our mobile testing site as well. On this slide, you'll see that part of our protocol also includes contact tracing, another critical point of our protocols. It's rounded out by a full suite of contact tracing to support our students, staff, and families. If a positive student is identified, Health and Human Services will begin contact tracing. This is going to be done in partnership with our school nurses who have been part of our contact tracing from earlier this spring. Together, they will work with the students and the families to identify potential close contacts, either in the school or in our community. Additionally, we're going to have services available for our students and families and staff and for things such as food access, so that we make sure recovery is able to happen at home in a safe, isolated manner. For staff who test positive, we will follow the state protocols for contact tracing. And this includes being notified by their local boards of health. Of course, we'll work closely with those individuals, communities, to make sure that our staff and our families who are outside of our community are able to survive, and that we can bring them back to our community as quickly as we are able. We'll follow all state practices that are out there to make sure that we have a safe environment for our students, staff, and families. With this, I'm going to turn it back to the mayor.
Thanks, Doug. I have a couple of more slides here, and then I'm going to have Dr. Scarpino go through a few slides. And folks, we'll go to about 7:15. We're supposed to be a 7 o'clock stop, but we started 5 minutes later. We're waiting for people to get on to the call. and we went a little long with the slides, so we'll take Q&A in a moment. But just a couple of updates. There'll be more updated town halls for updates that we're scheduling for October, and then in November, there'll be a series of Resistat town hall meetings. Again, a series on pandemic-related town halls throughout the fall and winter. And you can sign up for city alerts at www.somervillema.gov/alerts. And you know the schools will send you out a very healthy series of emails and updates as I get mine every day. When we do get the questions, as you're formulating questions, I'll remind you, those who are on the Zoom call can please use the Q&A function. Those of you watching on YouTube Live, please use the comment section. We'll be looking at that. Those who do not speak English as their first language can offer a question in a native language, and we'll have that translated. Right now, I am going to ask Dr. Sam Scarpino, who has a hard stop by 7, to give his just brief update and input regarding the aerosoling of respiratory droplets and the dangers it poses for transmission. Dr. Scarpino.
Great. Thank you very much, Mr. Mayor, and thank you all for being here for this important conversation. I think that the host needs to grant me screen sharing privileges before I can show a few slides. And while that's happening, I'm very happy to share the slides and the scientific references with anyone who's interested.
Dr. Scarpino, you should be able to do that right now.
Yep. All right, great. So I just wanted to show a few slides in particular around aerosol transmission, because as we've seen with the US CDC, there's been quite a bit of back and forth just in the past 12 hours around the CDC's recommendations regarding aerosol transmission. And so I just wanted to provide a little bit of the current scientific evidence. And just by quick way of background, some of the work we've been doing with the city involves a collaborative project called covidamp.org that has compiled over 400 different school reopening plans from around the United States that capture quite a bit of detailed information around the specifics of the school reopening plan. And so these are the kinds of data that are powering the decisions that are being made by the City of Somerville around the school reopening plans, trying to leverage the best wisdom collectively from around the United States as different school districts are dealing with similar challenges. We've also paid close attention to the U.S. National Academies of Sciences program around safe reopening for fall 2020 for grades K through 5, although most of these recommendations are relevant all the way through K through 12 and even colleges and universities. And I wanted to highlight, and I apologize, these are labeled 1 through 7, they should be 1 through 4. 4 key questions that the report recognizes when it was published back in the summer as key open questions. The link between children and the transmission of COVID-19. This has now been well established that children are capable of transmitting COVID-19 to each other and to adults, which is the reason why the testing, physical distancing, ventilation, mask wearing policies that you've heard about this evening are so vitally important for a safe reopening of in-person schools. The role of reopening schools and community spread, this is still very much an open question because as we've seen nationally, there just haven't been that many schools that have been reopened long enough to learn about the community spread, although that is certainly a risk. And again, one of the reasons why the measures we've heard this evening are so important, both for the individuals that are attending and working in the schools, but also living in our communities. Airborne transmission of the virus, in particular aerosol transmission, the evidence is building and increasingly strong that aerosol transmission is one of the primary routes and one of the main risk factors for COVID-19 transmission. It is not the only one. Surface contamination and droplet transmission are also important, which is why cleaning surfaces and mask wearing are vitally important. But with this aerosol transmission, the risk for longer range transmission than the 6 feet, that's why the ventilation is so important, especially in the school settings. And then the effectiveness of various viral mitigation strategies. Again, I think it's become increasingly clear that high rates of testing, mask wearing, and now ventilation, especially as we move indoors, are important pieces. So I'll just show you, I'm going to skip over this slide. This was published actually in New England Journal of Medicine back actually in early 2020, showing that SARS-CoV-2 can survive as an aerosol for hours, can survive on copper, cardboard, stainless steel, and plastic. So we've had evidence really back to February, published in one of the premier peer-reviewed medical journals, that SARS-CoV-2 has all the necessary conditions for aerosol transmission. In a review published just a few days ago in the Annals of Internal Medicine, They conclude reviewing all of the published studies they were able to find on transmission. So not just laboratory studies about capacity, but actual transmission. The dominant route, and I'm quoting, the dominant route of transmission of SARS-CoV-2, which is the causative agent of COVID-19, is respiratory. Growing evidence indicates that infectious virus can be found in aerosols and exhaled in breath samples, and it is likely that under certain circumstances, including during aerosol generating procedures, singing, long periods of time in indoor environments with poor ventilation, the virus may be transmitted at distance through aerosols. Again, building scientific consensus from a laboratory and experimental perspective and a case-based epidemiological perspective that aerosol transmission is one of the key routes of transmission of this virus, and why ventilation, safe ventilation, is so vitally important as we move towards a safe reopening of in-person schools. I want to highlight just one more result, and this is why the focus on influenza vaccination, the focus on testing has to be a piece of the puzzle for reopening schools safely. And this is the building and consistent evidence. This is published in the Annals of Internal Medicine, again, just a few days ago, that individuals are infectious and able to transmit SARS-CoV-2, the causative agent of COVID-19, before they show symptoms. So these are not individuals who are asymptomatic and may never have symptoms over the course of their infected period. These are individuals who will develop symptoms, but are infectious before they develop symptoms. And that's what's showing on this chart here. The 0 on the x-axis is the date of symptom onset for the patients, going back to -5 days or +14 days. The cycle threshold has to do with PCR detection of infectious virus. And the dotted line there is the best estimate from the literature of adults who will go on to develop symptoms, showing that their peak infectiousness is actually in the day just prior to symptom onset. The last study, and this was published again in the CDC's leading emerging infectious disease journal, and this was one of the things that predicated their initial announcement yesterday, although it has been changed again as of this morning. A study in China showing that individuals who are pre-symptomatic with SARS-CoV-2 will infect light switches, bathroom door handles, pillow covers, duvet covers, sheets, towels, very, very rapidly within a room setting. And these are infectious virus that were covered off of these surfaces. And so both aerosol transmission, but also aerosol transmission that then accumulates on surfaces and can be infectious. So it's why this integrated plan that we heard from the mayor and the rest of the team at Somerville, superintendent and her team, around having cleaning, testing, ventilation for aerosol transmission, mask wearing, et cetera, are all going to be important pieces together that will allow us to have a safe reopening of schools. So take-home messages: children and teen can transmit COVID-19. Mask wearing, limits on group sizes, physical distancing are essential. Apologies for the typo. Aerosol transmission is a risk. There's both laboratory, experimental, and epidemiological evidence for this. And symptoms are an unreliable metric. There's also a large risk of hospital admission increases due to influenza, which is why vaccination for seasonal flu is so critical. And the slide I skipped over, and again, I'm happy to share this, shows consistent evidence at the school level that vaccination reduces teacher absenteeism due to influenza, it reduces student absenteeism influenza, and even if the vaccine is only 30 to 40% effective, is an effective tool for reducing the influenza burden in our K-12 schools. So with that, I'd like to thank you all very much, and if there's time at the end, I'm happy to take questions.
Thanks, Dr. Scarpino. So we are here to answer your questions, and we'll do the best to get through as many as possible. If we don't get to your questions, please know that our school communication staff are regularly sending updates to parents, and the information may already be there. They will also gather the unanswered questions tonight and use them as a guide for future emails and web information. And if your question is specific to your child, as always, you should contact your school principal. Again, some important reminders, information and links you can refer to. We thank you for joining in the meeting, listening to the presentation. At this time, I'm gonna go through the questions, as many as we can, direct them to the right individual. And if you have any questions for Dr. Scarpino, I may take those in advance because he has a hard stop at 7. We will stop at 7:15 to make up some time that we had to start a little late, but please understand that there are some members on this call that have to, participants go to a school committee meeting, which starts at 7. So without further ado, I'm going to go to the Q&A now. And I'll try to recognize those who've, even if it's anonymous. So an anonymous attendee, it's a general question. I'll give this to the superintendent. When will the children of Somerville receive their legal right of equality, compulsory, and free public education? Mary, do you want to take that? Thank you for the question.
Sure. What I would say is that, we have in our remote plan, we've adhered to all the guidance of the Department of Education, and we are doing our best in the remote setting until we can safely return in the in-person hybrid that we discussed tonight. So in terms of the remote, we should be meeting the guidelines of DESE. And if there's any questions about the remote, you can direct them to Mr. Mazza, to myself, or to the principals.
Thank you, Madam Superintendent. Why is the lens of returning myopic? This is from another anonymous person. Thank you for the question. Why can't Capuano be the SPED school, East have ELL, Genziano, pre-K and K, Kennedy or West to take 1 and 2? Mary, to your team.
Sure. I think that is our next step now that we've, Mr. Raish has been able to give us the building reports. We'll be working with his team to identify the timeline for the buildings. And then we'll look to see which populations can be brought back, not only in their own schools, but if we have to make adjustments to serve them in other buildings.
Yeah. From Laura Boretsky. Thank you, Laura. Where are you in the evaluation process of the school buildings, safety, i.e. how many buildings have been evaluated? Also, once you determine exactly what work needs to be done, what will be the process of getting funding for the work and getting the work done look like? This was earlier in the evening and we've gone through the presentation, Laura. Hope that answered all those questions. It should have. We will be publicizing the slide deck. Thank you for that question. From an anonymous attendee, a safety first approach isn't just about COVID. There are other health and safety issues that are failing. We recognize the needs of many of our students that are health and safety related, all of them in terms of their development. Some of them have other particular needs. That is a concern to us at the forefront. Mary, do you want to add to this?
I would just say that we want to be able to get our students back in person as quickly as we can safely. This is the reason why we put so much work into the remote, to have that be a more quality experience. And certainly on the social emotional piece for students, that's a huge component of the remote. Our counselors are fully engaged and accessible and available at all times. So share the concern with the viewer. And this is why we're all working so hard to be able to bring our students back as quickly as possible, but safely.
From Naima, and I apologize if I mispronounce your name, Naima or Naima Sayed, why is the first parent conference of the year scheduled for election day? This discourages working parents from voting. Mary?
Sure. So we scheduled it because the schools are closed. And so that gives the ability remotely to be able to have some flexibility on this. We're actually looking to have our educators be able to meet one-on-one with families. So you're going to be getting some additional details on that will, I think, meet the flexibility you're looking for.
Thank you. From Mara Sidmore, thank you, Mara. Two-part question. Could you address current outdoor after-school programming, some community schools, some rec, in conjunction with a timeline outline for opening schools? It looks like there will likely be a length of time when it's too cold to be outside and yet schools will not be open. What will these programs do? That's the first part, Mary. Do you want to answer that? Then I'll read the second part.
So I think now that we know it's a December 1st, this will be something that we'll look at for the space of time between November and December to see if we can utilize the tents more, to see if it's shorter duration, but more often. I think this is the next thing that we will sort of tackle to see what our options may be.
And the second part of Mara's question is, what is the rationale of the cohorts attending after-school options on opposite days, particularly if schools reopen?
Mm-hmm. So I think we had the kids labeled with the cohorts so that when we do come back in person and hybrid, it's more seamless. We began this as a way, as we heard from parents, to be able to allow students to have some in person and then to be able to have some recreational time with their peers. We are also sort of taking the feedback that parents have given us And we will work toward, when that time comes for the in-person, of being able to, for the parents that want a full day experience and be able to have rec or CS on those days, how we can best accommodate that for them. We've heard some feedback that that would be helpful to some of our families.
Thank you, Mary. This is for the health team. Will positive cases found in the schools be sent anonymously to health departments, since there is a possible risk that the Affordable Care Act would be struck down and private insurers could stop insuring for any conditions that are related to COVID later? From Erin Hemingway. Erin, thank you for the question. Doug, do you want to answer Erin's question? Do you need me to repeat it, Doug Kress?
Yeah, could you repeat it? Because I kind of missed out on part of that question.
Sure. Will positive cases found in the schools be sent anonymously to health departments? And the reasoning is concerned since there is a possible risk that the Affordable Care Act would be struck down and private insurers could stop insuring for any conditions that are related to COVID later.
So thank you for the question. Because these are communicable diseases, the health department will be involved with the aspects of doing contact tracing. That's how we're going to slow this virus. And that's why we need to make sure that we have this information so that we can continue to do that. Because it's communicable disease, just like any others that we have in our area, they all have to be reported through the state health department. So they would be part of the system within there.
Thank you. From Buffy, and Buffy, you're gonna, I'm sorry again, I'm gonna try, mess up this name. Ankadokwi, Buffy Ankadokwi, our question is related to wanting to know error rates for all the buildings existing and potential scores for the air quality ventilation. From Lewis and Buffy. Thank you, Lewis and Buffy. Rich, I'll send this back to you again. Our question is related to wanting to know error rates for all the buildings existing and potential scores for the air quality / ventilation.
Error rates?
Error rates.
So you know we've got the scores for everything in there, and the score that will shake out when we do all of the updates to those systems. And with the scoring of the 1 through 4, you know, we're fairly positive that we've got the right number for each one of those systems in each one of those spaces. So I'm less concerned about error. I think that the only thing that we'll have to validate is after we've done the improvement to an area to make sure that that system is then operating the way that it is intended to. Which I think is also the reason why, even though in theory the Brown School could get down to a 2.01, we're not comfortable with saying that's an occupiable space, because that's almost in an ideal situation. If the equipment moves in there and isn't 100% efficient, then you're not in that zone. Do I think that the schools that we're targeting for improvements are ones that are squarely within the mid ones, so that even with some margin of error on the performance of a system, we're still certain that we're in that low risk category.
Thanks, Rich. From Elizabeth Pinsky, thank you, Elizabeth. I'm really concerned about the presentation on surface transmission data. Do you guys have an infectious disease doctor advising you? Yes, we've had the luxury, as well as other municipalities in the region or around the state, having access to well-renowned doctors, infectious disease doctors like Paul Bittinger of MGH, Rochelle Walensky, and others. Thank you and a whole cohort of experts, health experts, doctors, epidemiologists. Thank you for that question. Going back to schools from Matthew Gregorowitz. Again, I apologize, Matt. Please comment on how pre-K through grade 2 children are supposed to learn how to read on a laptop computer. Mary, can I hand that off to you?
Sure. So I'd actually like Dr. Q to talk a little bit about this, to start from just the early childhood side.
Sure. I mean, it's a valid question, and our teachers are really have a lot of expertise in thinking about how children learn language and learn expressive and written language, and have been preparing for this moment using the skills and information that they have and have used in the past. And so when we think about expressive and written language, those are ways for children to learn to read through storytelling and the initial mark making that they do naturally. And so part of the work that the teachers will be doing with children is to build upon the things that children do naturally and support families in being able to have children do that. So when we think about those things like storytelling and mark making and initial writing, all of those things are happening in the home anyway, and it's part of that relationship between teachers and families to build upon the skills that we want children to have.
Matt, you get the next question because you complimented me for I'm pronouncing your name right. It says, when you come back with hybrid, how are the teachers going to teach the computer half of the class while simultaneously teaching the in-person half of the class?
Yep. So this is a great question. This is actually the stumbling block that I think many districts are on. This is the work that we will be doing with our teachers and figuring out what other resources, which teachers will need to teach remote fully and which teachers will be able to come in person. Additionally, looking at what are other staffing models that we may need to implement to complement some of the teachers that are in person in the building to support those students. So this is the piece that we will be working hard for the next month, pulling together, having looked at sort of what has not worked in other districts, frankly, to figure out what's the best way to support not only the students, but the staff as they are attempting to reach out to the students that are at home at the same time that they are teaching the students in front of them. One piece of this will be what portion of the students want or parents want to remain remote. And so we may be able to attach some of our staff who need to work remote in that fashion. But we still believe that we're going to need to add to the model and provide additional supports within the classrooms for the at-home.
So leads to another question from Pearl Emmons. Are you hiring more teachers?
Again, to that point, that will be one of the key pieces we'll be evaluating as we begin with the hybrid to think about what that looks like for a teacher supporting students with students and staff supporting students in front of them and a certain portion of students at home. That is a key piece of what we will be working with our teachers union on.
From Dmitry Vasiliev. Why are other schools able to open in hybrid but not Somerville? Why are you making children age 6 years old spend 2 to 5 hours in front of the screen? This is not good for the kids, and our children can't fall asleep at night because of the increased screen exposure. It's not healthy. Let me start this off before I hand it off to the schools. I can't speak for other cities and towns and school districts, but this was a mess that the Commonwealth and the Department of Early and Secondary Education, Dimitri, dumped on cities and towns to figure out on their own. They have no plan. And and many communities don't have the capacity we have, and we barely do, to put together the integrated and in-depth plan that you've heard tonight. And some, honestly, are willing to accept a higher risk for their community, their kids, even just basically opening windows and social distancing. We will not do that. We're not going to do that. And our decision is based on science and research and guided by experts like Dr. Scott Pino. Mary, do you want to take it from there?
Yeah, I would just say that from the start, we've been looking for a model that focuses with sustainability as well. The idea of not needing to start something and then stop it or begin something and then push the date, which was why when we recognized the complexity of this, keeping the health and safety, we decided to really focus on the remote to begin. And I think what that's allowed us to do is to develop a remote model that is robust and will allow us to carry throughout the year, whether we're full remote in the beginning and then as we go hybrid in person. And that's something that is a difficulty in many districts right now as they begin to sort of go back and forth. So,
yeah. And the other question, again, Dimitri asked, it's good because I know it's on a few comments' minds here, and I'll just recognize it from several people. Where are the Brown students going to study and when? Can you let us know what are the location options considered, since it seems like the building is designated as never to open? At present, if a building is not at low risk, it will not open. And as Rich Raish, and I'll leave this for Mary and Rich and others to answer, has stated, we are going to continue to make those improvements to those buildings. Other factors, the external factors will continue to evolve. We'll learn a lot more as this virus and pandemic evolves and as we take on a resurgence and afterwards. So it's a question of when, given external factors and other factors out of our control, that allow us to open a building that has moderate risk. Right now, the risk is too high, in our opinion. Mary, Rich, do you want to add to that?
Or Rich, do you want to go first, then I'll follow?
Yeah, so, what we're working through next is the timeline to achieve our threshold in each one of the spaces. And as we know that, working with Somerville Public Schools on what the best uses of those spaces is. So we will be taking a serious look at how to accommodate the Brown School students either in other elementary school buildings or the other piece of real estate that's obvious that is usable are the mods. And that may or may not be the right answer. I'm hoping that we have that overall plan developed and can announce it within the next couple of weeks. But as we sit here on the 21st night of September, I can't say exactly. Mary, if you want to say anything else about that.
No, I think that's right. I mean, I think it's working conjointly to ensure that we're looking at which parts of the buildings and which buildings come online and when, and then being able to look at the priority populations. In the case of a school being fully displaced, that's clearly a priority. So I think the mods is certainly one that we will evaluate closely.
Yeah, and in round numbers, the number of rooms and the square footage works out. It's almost a 1-for-1.
Yeah.
Thank you. The next question from Chad Laurent. I've taken advantage of the free Somerville COVID testing via the Cambridge Health Alliance twice. I found it quite painful, deep swab. I assume they will not test children via this method. If it's acceptable to not use such a deep swab method, then why is Somerville still using it for adult testing? Doug?
Sure.
Respond to this. Thank you, Chad, for the question.
Sure. Thank you, Chad, for the question. And we are transitioning to the anterior nasal swab as we speak. I know over at the Assembly Square location, we have transitioned over to the shorter swabs, which are just right inside the anterior of the nose. And that's the type we would use. We agree. We want to make sure that the testing that we're going to be using is going to be some less invasive than the nasopharyngeal, which, as you said, is a little tickle of the brain. So we are looking at the other styles that are out there.
And that's really welcome news by all of us, Chad. I've had 3 tests, and the last one, I still feel it today. Though they're important, we encourage people to get testing. We're looking at less intrusive options. So thank you for that. Aaron asked about Dr. Scarpino slides. We will work to have Dr. Scarpino slides as well as these slides publicized for all of you to view. Thank you for that. Aaron, what's the possibility, this is back to Mary and the school team, the possibility of switching after school days once we go hybrid to provide after school care actually after school? And that is from Annie March.
Hi, Annie. So I will have Jeff comment on this, but I think this is one of the things that I was saying we are going to look into. We did hear from some parents that they would prefer to have the all-day care for the 2 days as opposed to spreading it out. So that is something we're actively looking to do, again, once we would come back in person. Jeff, I don't know if you want to add to that, Dr. Curley?
Yeah, I think that's right. So we've heard a lot of feedback from parents. I think once we have access to the building and community schools can use that as a staging ground to run programming, we will likely offer that option where the after school can extend into later hours on the days that students are going to be in person. And one of the reasons we'll be able to do that is that 12:30 to 2:30 program for pre-KK students will go away as those students come back, and those hours can be shifted later in the day. I know parents are looking to have the 5:30 coverage again. So that's something that we will work on and communicate in coordination with the return of in-person hybrid.
Thank you. From Lauren Hanley, are there any medical doctors on the reopening committee advising the mayor and the city? Yes, I mentioned his response to the other question, a couple, Dr. Paul Bittinger, Rochelle Walensky. We've also had access to other experts and doctors like Louis Ivers and Michael Meaner. Louis from Harvard MGH and Michael Meaner from Harvard and Brigham Women's Hospital. So we do have a whole cohort of experts and doctors and medical people we've been engaging and getting guidance from. Thank you, Lauren, for that question. From Amy Myrtle. Thank you, Amy. What has data from private school/daycares that have been open for a while already shown about the relationship between the level of ventilation and transmission? Since Scott Pino's on the call, we're learning those lessons now. As more information, let's just say from the beginning, we've all learned a lot and continue to learn a lot about COVID and around school opening. We learned the lessons that are happening before us right now. So we see outbreaks in school districts around the country. We see a 51% increase amongst teachers and staff in a report that came out, I believe, yesterday. And we're learning lessons around different school districts. That's still playing out. But we also have lessons from around the world in countries like Israel. So we need to be very cognizant of that, as well as looking at the data we see every day. And I think that part of the external indicators we continue to analyze. So as those lessons come to our attention and we learn more about it, we'll be talking to you more about it. Thank you for that question. What is happening? I'm sorry, how confident are you that there will be, and this is from Raina, excuse me if I mispronounce, how confident are you, the school district, that will be an agreement from the union to ensure that teachers are there within the plan's timeline?
We are meeting on a weekly basis with the union to discuss an array of issues. And I think one of the most important things to successful negotiations is having regular and open communication. We had that throughout for the remote learning plan. And I think what we produced was something that is a very good remote learning system for our families and students. So I will go into that with the same level of confidence that with good communication and regular meeting, we will be able to have that good faith effort together.
Thank you. From Laura Beretsky, Laura Beretsky, thank you, Laura. Will testing be required of everybody entering the building or only those displaying symptoms? Doug, do you want to restate that? Doug Kress, please.
Sure. Thank you for the question, Lauren. Yes, this will be everybody who enters into the building. This isn't just for those who are showing symptoms, because remember, we have a lot of individuals who are asymptomatic that are out there. And that's why we want to look at the universal testing. It's one of our pillars within our whole metrics that we're looking at within reopening our schools.
Thank you, Doug. I want to get to folks who haven't answered a question, who haven't asked the question yet or had their question answered, so please bear with me. From E. Gaskell, if I'm stating this correct, I don't know if that's short for something, but thank you for the question. Can you tell us what other school districts that are reopening meet these criteria?
So I mean, I'll speak from the education side. I don't know. I haven't compared other districts. Our goal, I think, is to look at Somerville and the uniqueness of Somerville and our community and the density, the age of our buildings and the populations that we're serving, and to make the best decisions for our student population and our staff. Mr. Mayor, I don't know.
Yeah, I can answer from the city perspective because I'm in conversations. I chair the Metropolitan Mayors Coalition, which are the 15 communities in the inner core region of the Boston metropolitan area. And I co-chair, facilitate a larger statewide and regional meeting with other mayors, city managers, and leaders. And I will tell you from the very beginning of this pandemic, and particularly at the schools, we've been asking for assistance, expertise, and consultation on how to approach school opening. We've had to do this on our own. I can tell you that other municipalities, including on a call this past Friday with the Lieutenant Governor and members of the administration, they've asked us how some of us approaching it to share our approach. Then there are other districts and municipalities who've taken the minimum amount of guidance and then implemented that. I'm not knocking them, but we're not willing to accept a minimalist approach to evaluating risk. The risk is serious. This, again, when we reemphasize, we know the virus continues to spread. People continue to become ill and people continue to die. So we are going to have standards that we're going to set a standard. We hope others will follow, and others I submit are following. I don't know all the particular plans, but I know these are the same questions and resources that many municipalities and districts are asking for. They're asking for from both DESE and the Commonwealth. Thank you for that question. From Lynn Weissman. Thank you, Lynn. It seems like the presentation focused on classrooms and offices. What is the risk like for gymnasiums in the schools? Thank you for the question, Lynn. Rich and others, you want to?
It's a good question. I sort of focused on the high volume areas, but the assessment was for all of the areas. And our goal is to bring all of the areas where students will be and faculty and staff will be up to the right standard for each one of those areas. And is there a possibility that a room or two will not make our deadline? That's possible. We'll have to deal with that, as it comes. But the idea is to bring all of the student spaces up to the codes where we want them to be.
Thank you. From an anonymous attendee, and thank you for this question. The question is, in the opinion of Somerville experts, are neighboring towns and private schools being reckless in reopening, thinking about metrics and ventilation? It would appear by this presentation that they are. Please comment. I'm just going to speak for us. I know we're being deliberate, diligent, and being informed by the highest level of expertise and the data. Some municipalities and school districts don't even have the capacity to begin that conversation, and the Commonwealth, neither the Commonwealth or DESE have provided that to them or the resources to find it out. So they're taking what they can do with the best they can do with the minimal amount of guidance that the Commonwealth and DESE have provided. Social distancing, masks, sanitizing standards, sanitation standards, and window opening and so forth. And again, on the calls I've been on recently, many have inquired what we're doing and how to approach even engaging an environmental engineer. Mary or others, did you want to comment on that?
No, I mean, I think that's right, Mayor. I think the only thing I would add is that the kind of partnership that we have with the cities in having access to the experts that you have brought in with the health and Rich has brought in with our buildings, I think is exactly what districts are craving to have with cities. That's been my experience in talking to colleagues.
Thank you. I have a couple of questions that came in from YouTube. So I want to give them an opportunity to have a question answered. From Lena De Benedetto. Thank you, Lena, from this question. My son has Down syndrome and I need help. He will not stay on a Zoom call for hours. I want to hire a tutor to help with his work. I am a mother, not a SPED teacher. What kind of funds do you have to help me? Thank you, Lena, for the question. Mary?
Yeah, thank you for the question. So Christine Trevisoni is on the call, who's our special ed director. I'm sure you'll reach out to the parent, but Christine, do you want to give some thoughts on that?
Yeah, hi, Lena. I can understand for you what's happening for your son. If you want to reach out to myself or to your son's case manager in school, we'll be happy to follow up with you and see how we can best support you in planning to support both you and your son.
Thank you, Christina. From Emmanuel Vincent, thank you. With aerosol transmission being highly infectious, what steps should parents take to see a decreased chance of transmission while the children are in school? Well, Doug, do you want to take a first run at this?
Sure. Thank you for the question. I want to remind us that, we've already been talking about a lot of these preventive efforts that we have in place. That includes making sure that we are wearing our face coverings, those face masks that make sure it's covering both your nose and your mouth, going down to your chin and covering up your chin. Wearing that correctly is going to be a critical part of that. I realize that sometimes those can be a little bit of a challenge, especially for some of our younger ones. But just like wearing a bike helmet, that became the norm. We need to think about that again as we look at this. here in our community as well. The other thing is practicing social distancing. We all know what that is, 6 foot, keeping those distance away is an important piece of that. And then finally, making sure you're washing your hands a lot. You know, in the spring, we were talking with our kids when the virus was first around, and we were having our nurses going into the different classrooms, making sure that everybody understood how to wash their hands. We can continue to do that. And it's getting back to those simple things that are going to help the transmission, reduce the transmission of this. Those are the aerosol ones that we keep talking about. So as a reminder, the public health practices we keep talking about: washing your hands, 20 seconds, warm water, making sure that you're wearing your face covering, and then also then practicing social distancing are going to be your key components to staying healthy and abating the virus.
Thank you, Doug. From Courtney Coslow, a compliment, not a question. Thank you. As a parent of an immunosuppressed young student, I truly appreciate this methodical, thoughtful, and cautious approach. Thank you for taking our individual and community-wide health and safety so seriously. This process is one that should be widely modeled. We thank you. And we're going to continue to work hard, and we're going to keep health and safety of everyone. We understand the inconvenience, we really do, and the pressures on families. We're acutely aware of that, but health and safety of everyone first. From Leah Bloom, thank you, Leah, for this question. Parents are eager to send their children to recreation and community schools programming, and children are desperate for social interaction. However, from what I've heard, there is no effort being made to ensure that children keep any social distance. Reports are that they are on top of each other. This undermines the safety precautions the city and the Somerville Public Schools have painstakingly put in place. Please explain why you're allowing it.
So we don't allow that. And I would say, Leah, thank you for letting us know that. If you could reach out and give us some information on where you're seeing that happen. Anytime that we've gotten a report, we reach right out to either Jill Latham or to Rosanna Parabala so that they can follow up with staff. There are some times that students may be having a mask break, but it should always be well in distance, well beyond the 6 foot distance. Sometimes people driving by see that and they will report it, and then we check, and that's what it is. But other than that, they should be keeping their 6 feet if it's an organized program. There's sometimes we get reports, and it may be that students have just gathered someplace in the after hours and it's not part of a formal program. It's still important to let us know, and we will make sure that we're reminding students through our school channels as well. Dr. Curley, do you want to just speak to the community schools? Because I know you've been going around to the sites and observing.
Sure. I would just say, as I mentioned in my comments, the programs formally started today. So if there were reports perhaps over the summer, that could also have been families coming into parks and playgrounds or onto schoolyards, which are open. And I know we have had times where there's been mingling of groups, and we had summer programming running while families were using the parks and maybe not observing the same mask and social distancing protocols. But to the extent anyone in the community sees that, if they can reach out to me or Jill Latham, I can route those concerns, and it is something we take very seriously. Thank you.
We have time for, it's 7:15, but I'm gonna take these last 3 questions, then we have a school committee meeting that has to start. Again, we will capture all the questions, a lot of information provided you from the schools or the city. There'll be other meetings, as I mentioned, scheduled, and always feel free to send us questions. From Donna Clark, thank you, Donna. In the current plan, only students with significant special needs are slated to go back in the first phase. Are there any plans to bring the other children with special needs back for in-person services before their dedicated phase 4 return? Thank you, Donna. Mary?
Sure. So that is something we will certainly evaluate, especially once we have a sense of the facilities and what facilities we'll have access to.
From Julia Cheliason. Hi, Julia. Thank you for the question. For Doug or Sam Scapino, sorry, Scapino is off. Julia, we can try to connect you with him, but Doug's on the call. What studies or evidence is Somerville looking at that backs up the lower nasal swab versus the brain tickle? Is the city confident about the test accuracy? Either Doug or Omar Bukilia both can add to this.
Sure. Yeah, we obviously are following those research and looking at which tests are the best. And what we are finding is that the anterior nasal are just as effective and reliable as the deep the deep brain tickle, as you have put it. So we are looking at that. We do have the studies. If you need copies of any of those, let us know. We'd be glad to share those with anyone.
Thanks, Doug. And this will be the last question from Tom Ross. Thanks, Tom. While I can appreciate the need for limiting class sizes, what is the result of a citywide occupy-able square footage analysis for accommodating K-8 students and prioritizing those with needs at risk? And if so, where is it published? Do we understand that question, folks? You need me to repeat it?
Can you say it once more? I think I do, but can you just say it, repeat it once
While
more?
I can appreciate the need for limiting class sizes, what is the result of a citywide occupy-able square footage analysis for accommodating K-8 students and prioritizing those with needs and at risk? And if so, where is it published?
So I think what Tom may be referring to is looking at all city assets as a way to be able to serve all K-8 students. So Rich, I think the question is whether or not other city assets in terms of all city could be used to be able to get more students back. I think that is the basis of the question, I think.
Yeah, we would not have eliminated that as a possibility, but the circumstance that we are in is that, with the exception of the Brown and the old wings of the existing high school, our school buildings are our newest and best building stock by far. And there are no municipal buildings that are will be more readily occupiable than the school buildings.
Thank you, Rich. And I promise you, this is the last question because I have not recognized Susan Lane for any questions. Susan, thank you. Data sharing with the broad, the data privacy controls in place to ensure that, example given, public data is not used for commercial purposes or that individual samples aren't repurposed for other goals. I would rather that our generic samples didn't end up being used for commercial purposes or publicly released. Doug, do you want to respond to that?
Sure. Sure. Thank you for the question. I think data security and also privacy are going to be critical within this entire process. This information is the part of our process. It is not part of the Broad Institute. They are simply the lab who will be processing it. So that is part of our agreement with the Broad Institute as we move forward with this process and protocol.
Thank you, Doug. I'm going to hand off to Mary after I say something. Again, we appreciate all your questions. I know you asked. There's some who are not answered. But again, for those who whose questions we didn't get to, please note that our communication staff at the schools in the city are regularly sending updates to parents, and the information may already be there. And as you heard me state a little while ago, we'll be holding more informational meetings. So thank you for participating tonight. And thank you for your collaboration, cooperation, and your patience. We are going to continue to be guided by the highest level of expertise, the data, the science. We're going to keep the health and safety of everyone in our community, our teachers, our staff, the students, their families, our neighborhoods, in the center of our work. Superintendent, I'll allow the closing remarks for you.
Yeah, just very similar, Mayor. Just really appreciate, I know that when parents are hearing the December 1st, there is a shock to that. I think it's important that we've been transparent along the way with each of our processes, and we have not committed to things that we then have to change. We're doing the best we can to ensure that all students and staff and families are safe. And the best way we can do that is, referring back to the Venn diagram that was shown at the beginning, to see this as a complex problem that's got a complex solution. And that is the buildings, that is the testing protocol, that is the virus itself. And so we will continue to work in partnership with the city and with our families to come up with as many solutions as we can until we're all able to come back together again in person. Thank you.
Thank you, Superintendent. I want to thank all our panelists, all our participants, the school staff, the city staff, for the incredible work, Dr. Scott Pino. And thank you for all you and the public, especially the school community, for engaging tonight. And there'll be more to come. Have a good evening, folks. Thank you.